So we're going to be talking about implementing a nursing care plan for adoption. And I just want to start with a couple of objectives. So our goals tonight are to increase your understanding of the legal and emotional processes of adoption. For people who don't deal with it on a regular basis, it can be a little bit confusing, and a lot of people don't understand exactly what the process is and how it works. So we want to give you that context. We're going to help you develop some skills to work with expectant parents who are considering adoption. We want to help you understand the roles and responsibilities of the different folks who are involved in the process. And we're going to wrap up with just a couple of strategies for supporting the adoptive parents as well, because particularly in a hospital setting, that's a little, it's a little different because they're not actually patients, but they're still there. So we're going to touch on that a little bit as well. And I also wanted to start with sharing with you a little bit about why we decided to develop this. And the motivation really came out of a birth mother support group that we run to help provide some ongoing support and a safe place to process for women who've made the choice to make an adoption plan. And through that support group, it's run by a staff member at Spirit of Faith. And we were receiving feedback and comments from birth mothers like, you know, we saw something in the group where a woman had just had her baby and posted that the nurses were treating her like an incubator, and 17 different other birth mothers agreed with her and said that they had experienced something similar. And another woman shared that she felt like the nursing staff were trying to break any bond that she built with her daughter. And we know that you don't enter helping professions for any reason other than what you want, that you want to help people. We know that this is not what nurses intend. And so we wanted to try and provide something that would give a different context for what you're experiencing, because this isn't part of the normal day-to-day. So we wanted to provide you with that support and with those skills so that it's a better experience for everyone, because adoption can be a stressful situation for everyone involved in it. So we're going to start just with some information about the process itself. And we're going to look at a couple of different aspects of what goes on in adoption, just to give you some context. So the first thing we're going to talk about is the legal process. And we're going to focus tonight primarily on the experience of the birth parents or the birth mother. So at the time that expectant parents decide that they want to explore an adoption plan, one of the things that has to happen is that a birth parent assessment has to be conducted by a licensed social worker or a licensed assessor in the state of Ohio. And this has a couple of different pieces to it. One aspect of this is a social and medical history, which is information that is voluntary, it's self-reported, but we get into their physical health, their prenatal care, their mental health, any substance use history, any domestic violence exposure, what their work situation has been like, what their educational situation was like. We go through 3 generations of medical history. And ideally, we do this process with both birth parents, both the expectant mother and the birth father, to gather this information and find out as much as we can about the situation and circumstances of these parents and about what we could be looking at in terms of this baby as far as health factors. So that's part of it. The second piece of the assessment process is a document that's called the Laws and Materials Form. And this is a document that explains to them, to the expectant parents, what their rights and responsibilities are if they choose to make an adoption plan. So at this point in the process, we go over with them the fact that an adoption is permanent and it can't be undone. And we talk to them about what that means in terms of their rights to their child and what they're able to do. In the state of Ohio, expectant mothers who are looking at making an adoption plan are entitled to some financial support. They have access to living expense funds. So we talk to them about that and whether that's something that they need and want to participate in. And then we talk to them about what's called the 72-hour rule. And in the state of Ohio, a birth mother is not allowed to sign a permanent surrender until at least 72 hours after she's given birth. And that's there to protect her, to make sure that she's not being unduly influenced, that she's not being coerced, that she's not under the influence of any pain medication she may have been given for the delivery, that her mind is clear and she knows what she's doing at the time that she makes that decision. However, there are circumstances where no one is aware that mom is considering an adoption plan until after she gives birth. And we'll talk about that a little bit more in a minute. But if that's the case, if she hasn't shared that plan with anybody, if she hasn't shared that thought with anybody, then no one's had the opportunity to do this assessment, and therefore no one has had the opportunity to explain to her that she has 72 hours to make this decision. So in that situation, instead of the birth of the baby starting that 72-hour clock, what starts the 72-hour clock is the end of this assessment process. So she has to be fully informed about what her rights are before she can move in to that process. So that can change the way things happen. And it can change some of the things that go on in the hospital setting, depending on when mom has made this choice and when she has started making her plan. A lot of times there are questions about how adoptive families are chosen. And that gets done through a matching process. So once that assessment is completed, the agency will take that social and medical history, and we'll use that to identify eligible families that the agency is working with that already have an approved home study. And once those families have been identified, then the expectant parents are presented with photo books and profiles of the appropriate families, the eligible families. And the expectant parents are then able to choose the family that they think might be a good fit for them, the family that they would like to parent their child. And once that choice has been made, the agency will set up a face-to-face meeting to allow them an opportunity to get to know each other, to have some conversation, and to decide after that point if it still feels like a good fit, if that's still something that they want to move forward with. So usually all of this stuff will happen before birth mom goes into labor. Sometimes some of this is happening after the baby's born. But it's helpful to know what the different steps are. But the truth is that adoption is not just a legal process. It's also an emotional process that these expectant parents have to go through. And so it's helpful to understand what's happening on that side of things while we're dealing with all the legal steps. So there's a number of different reasons why an expectant parent might make an adoption plan. It could be a lack of financial resources. They simply don't feel that they can afford to raise their baby in an appropriate way. In some cases, there's a fear of violence or abuse from either a domestic partner or someone else in their world if they try to bring this baby home and raise this baby. But usually underneath those reasons is simply the desire to provide a better life for their child than they believe they're capable of providing at the time. These women and men genuinely love their children and are doing the best they can to provide the best life possible for their child. And I think that's something that, as parents, any of us want for our kids. And so that's an important thing to remember as they're going through their process. They generally are trying to do the best thing possible for this baby. But this is not an easy choice to make in any circumstance. And not only is it possible, but it's actually very common that they're going to reconsider their decision multiple times as they go through the process, and they'll go back and forth. An important thing to remember is that whatever choice they make, whether they choose to parent or whether they choose to make an adoption plan, any choice that's made in this circumstance is going to be an emotional choice. And we all need to expect them to be emotional about it. Being sad about the choice that they've made is not the same thing as being uncertain or being insecure in the decision. Sometimes they're just sad at recognizing that this is the best choice and it is the right thing. So we're going to shift focus a little bit to how, in the hospital setting, the best care possible can be provided for these women and men who are going through this process. So we want to talk about what that looks like for a little while. So the first step in the process is identifying an expectant parent that's considering an adoption plan. If the expectant mother or parents have been in touch with an agency, if there's an adoption agency that they have been working with, then that information should be available somewhere in the patient's record. Agency representatives will have been in touch with the doctor and with the hospital prior to labor and delivery to provide for release forms, to provide information about what the birth plan is, to let the hospital know that this is expected to be an adoptive placement. And the agency will do everything they can to coordinate with the hospital social work staff in advance so that everybody knows what to expect and everybody's on the same page about how to move forward. If there hasn't been any agency involvement, either because this is a new thought for birth mom, or if it's something that she's had in the back of her mind but didn't discuss with anybody and didn't reach out prior to delivery. Expectant moms, birth moms, have been known to ask any member of hospital staff for information on adoption. So if that happens, it's important to be aware of some next steps. So in terms of the care plan as a nurse in labor and delivery, we put this together as a sample goal for your care plan, to provide medical care and objective information to support expectant parents in identifying and or executing an appropriate parenting plan. These moms may come in talking about an adoption plan and they may change their minds after delivery and choose to parent. They may come in planning to parent and ask for information about adoption. It can go either direction. but the medical staff on the labor and delivery floor are going to be the people that they have the most access to. So very likely you're going to be the ones that are going to hear about these decisions more often than not, or the questions, or the clarification. I would say this is especially true in the last year or so. Prior to the pandemic, it was standard practice that an agency representative would be in the hospital when an expectant mom went into labor who was planning on an adoptive placement, to be there to coordinate with the hospital staff to support birth mom to help navigate all of this. The truth is that in the pandemic, in most cases, adoption agency staff are not allowed in the hospitals anymore. So we can't be there directly to help with the process. And that has complicated things a little bit. So what are some practical things that you can do if you do have an expectant mom on your floor that is looking at an adoption plan? First of all, you want to connect them with the hospital social work staff, hospital social worker, so that they can provide some of that hand-holding and guidance that's outside of your area of expertise. If there is an agency, you want to know who that agency is and who the contact folks are. Make sure the agency has been notified that the baby's been born. If there isn't an agency that's already involved, it's helpful to have some information about local adoption agencies in your area so that if someone asks, you have some options to provide. I know Spirit of Faith has a 24-hour hotline and will respond. I believe most other agencies do as well. So if that's the situation, we're going to get involved as quickly as we can to make sure everyone has the support that they need. You want to document everything appropriately and clearly so that as there are shift changes, if somebody else comes in, everyone's aware of what's been going on and what the plan is. When there is an agency involved, frequently they will have the birth parents sign a temporary custody agreement that allows the agency to have temporary legal custody until the permanent surrender can be signed. And if that's been done, then the agency will provide a copy of that for the medical records so that staff will be aware that that's taken place. Again, in the current environment, when we're not necessarily allowed into the hospital to get that signed, that may be something that we coordinate with the hospital social worker to get signed on behalf of the agency so that we can have the right documentation in place. As I said before, when you're dealing with a birth mom, recognize that her emotions are not indicative of uncertainty. It's just a lot to process. And when you add the hormones and the everything else in on top of that, it's just a difficult time. So the best thing you can do to support her is to remain objective. Some women are going to need to process out loud, and so they're going to be talking about things, and they might ask you questions. Do you think I'm doing the right thing? It could be anything. The important thing in your response is to remain objective and to allow them to make their own decisions, to support them in making the choice that's best for them and for their child. You want to communicate with agency staff, the hospital social worker, and other nursing staff to provide continuity of care. And some of this is going to be things like whether or not the birth mom wants to nurse while she's still in the hospital. Some of them do, some of them don't. Some women aren't comfortable even seeing the baby while they're there because it's too intense, it's too emotional. But whatever those things are, in order to protect her so she's not having to have those same conversations every time there's a shift change, communicate that information and share it so that everybody knows what the plan is. During those first few days while she's in the hospital still, the birth parents are the ones that need to consent to circumcision, any testing, any immunizations or treatments of any kind that are given. That goes through the birth parent. And support them in providing whatever care they're comfortable giving, whether that's physical care or emotional care. Some birth mothers have ceremonial activities that they want to take place while they're still in the hospital. Those could be religious, it could be something else, it could be a family tradition. But support them in the things that they're able to do and that they want to engage in. Assist them in completing the birth certificate. At this point in the process, their last name is the baby's last name, and whatever first name they choose belongs on the birth certificate. And they may need some help getting that filled out and working through that process. You also want to make sure you're providing them with discharge instructions that are appropriate to their situation. If they're not going to be leaving the hospital with their baby, you don't want to put them through discharge classes on how to go home and care for your newborn. So be sensitive to those things and keep those things in mind. So what if there's a health issue and the baby is in the NICU? This is a little bit different, little bit of a different situation. Again, while the birth parents are still in the hospital, they have primary responsibility for making any decisions about the care of the baby. If the birth parents have signed a temporary custody agreement giving the agency legal custody of the baby, then those decisions will need to be made jointly between the birth parents and the agency. Once we've passed that 72-hour timeline and the birth parents have signed a permanent surrender and the child's now in the custody of their adoptive family, then the adoptive parents will be able to make any care decisions and any treatment decisions. However, the agency will still have to sign any consent or authorization forms because the agency will still have legal custody of the child. And that kind of takes us into the adoptive parent piece of the puzzle. And again, this is a little bit different in COVID world. In most of the placements that we've been involved in the last almost a year now, in some cases, the adoptive family hasn't been allowed into the hospital at all. In some cases, they've been allowed in the hospital, but not until after the birth mother has been discharged from the hospital. So there's no overlap and there's no contact there. So it is a little bit of a unique environment and it's made it a little bit challenging. But whether they're present before birth mom is discharged or not until after, it gets a little bit complicated because they're not actually patients. And so it's hard to know how to interact with them all the time because it's not a typical situation. But if they are present, they're going to need information and they're going to need assistance. And again, especially now when agency staff isn't allowed to be there, we're not around to facilitate those interactions between the adoptive parents and the hospital staff. So it gets a little bit complicated. If they are allowed in before discharge, the birth parents may or may not want contact with the adoptive family. It really is up to the birth parents how they want this to go. And they have control over what those interactions are and what that looks like. So what we recommend in terms of the adoptive parents is to treat them like they're extended family members of the birth parents, and to interact with them in that way. So you want to be supportive, you want to be informative, you're not going to engage on a deep level, but you'll give them the information that they need in order to move forward with the things that they need to do. And again, ideally, agency staff will be able to facilitate the interactions someday when we're done with COVID and everybody's allowed back in and things go back to normal. If you have a situation sometime in the future where sometimes you'll have a birth mother that's working with an out-of-state agency, you may be able to find a local agency like Spirit of Faith that would be able to come in and provide coordination services to help smooth over that process. So there are some options there. For the adoptive family, attachment and bonding is critical during the early days. So ideally, as soon as the birth parents will allow it, as soon as hospital policy will allow it, best practice is to allow the adoptive couple to start spending time with the baby. If possible, it's good to have a private place for that so that they can start to bond as a family. If that's not an option, then trying to find some other arrangement somewhere in the nursery, somewhere in just a spot where at least they can spend some time together and start to get to know each other and start to connect and bond. And I'm talking really fast tonight, so I hope you guys have lots of questions. So the last piece of the process then from the hospital side is the discharge of the baby. And this is something that should be identified and coordinated ahead of time so that, again, everybody's on the same page and it's a clear process. We'll need to communicate about the timing of discharge. Usually, it will be the agency representative that will sign discharge documents because the agency will have either temporary or permanent custody of the baby. But there's a lot of different ways that discharge can happen. The baby can be discharged to the agency. If placement paperwork has been signed, then the baby can actually be discharged directly to the adoptive family because they now have physical custody of the baby. If we have a situation where the baby's ready to be discharged and we haven't made it past those 72 hours yet, we're not allowed to take a permanent surrender from the birth family. Then the baby may be discharged to a cradle care family, which is a licensed foster family that's going to provide support for the baby until the baby can be placed in the adoptive home. So there are a lot of different factors there that can be considered. And I guess I'm going to back up for a second and just clarify a little bit. So I had talked earlier about the 72 hours. Once we're past that 72-hour point, then the birth parents are allowed to sign the permanent surrender documents, which terminates their parental rights and all access to the child. Once that happens, placement paperwork will be signed with the adoptive family immediately after the signing of the surrender paperwork, so that they become legally able to provide care for the baby. So that's where some of this makes a difference. Ideally, hospitals will allow the baby to stay for the full 72 hours, and then we can discharge directly to the adoptive family. Understanding now that there are some different circumstances and that's not always the best choice, that's where some of these other options come into play. If we haven't reached the point where permanent surrender can be taken and the baby can be placed directly with their adoptive family, then we need to look at some of these other circumstances and some of these other nuances. And so whatever that is, agency staff, hospital staff, and the adoptive family all need to be on the same page about what that discharge plan is. And then the hospital social worker also needs to be in the loop in case there's coordination that needs to happen after that discharge, or there's something else that needs to happen in the hospital, so that all of the different parties involved can be on the same page. So that was a lot of stuff, and I talked a lot faster than I thought I was going to. But I would like to go ahead and open it up for questions at this point. And feel free to unmute and ask a question if you have one, or you can type it in the chat box.
Hi, yes, I have a question.
Yes.
You mentioned, yes, I'm sorry, I have a 3-year-old.
No worries.
I know. You talked about temporary custody and permanent custody and how that gets a little tricky in the NICU. How is it determined what type of custody at that point is established?
Usually what we'll try and do is have the birth parents sign a temporary, because even before the pandemic, usually birth moms being discharged at 24 to 48 hours after delivery. So ideally what we'll do is we'll have birth mom sign a temporary custody form before she's discharged from the hospital, so that the agency has the ability to make care decisions for the baby once she's gone. And so standard practice, best practice is to have her sign that temporary custody form. And that carries us over until the end of the 72 hours or whenever she signs that permanent custody. That covers that gap so that the hospital has access to someone who's able to make decisions, who's able to sign releases and consents, and is able to make decisions on behalf of the baby.
Gotcha. Thank you.
Okay. And Kathy, I like your comment. Yeah, I could never give my baby away as a common response to things. For those of you who didn't pop up the chat, Kathy says, I work at a pregnancy center. Help with beginning conversations with an unplanned pregnancy options conversation. The answer is so often, I could never give my baby away. And we actually have other trainings that are specifically geared toward pregnancy centers. So I would encourage you to look at those too. But it's not a short answer because it's a complicated question. In my experience, there are 2 levels of decision-making that happen in a crisis pregnancy. So the first round of conversations is, are you carrying this pregnancy to term or are you not? And we have to start there, because I know, especially culturally, we like to make this one choice. We like to make it the abortion or adoption discussion. That's not the way it happens. And that's not the way it works for most women. So that first conversation is, are you carrying this pregnancy to term or are you not? Once you make it past that conversation and she's carrying the pregnancy to term, now you start talking about, okay, let's look at making a parenting plan for this baby. And who is the best person to parent this baby? And maybe the answer is you, and you just need some help and support. And let's talk about how to do that. Let's talk about how to connect you with resources. And maybe the answer is that the best person to parent your baby is someone else. And we talk about making a plan for someone else to parent your baby. So I think that's the first part. But I think the second part is, the second part of my answer there is to reframe that. Making an adoption plan for your child, when that's in the best interest of your child, is being a good mother. These women are good mothers, and they don't stop being mothers just because they make an adoption plan. And society doesn't tell them that. Society tells them that they have failed as a parent if they're making an adoption plan. And society's wrong. So we in the field need to be the ones who are reframing that for them and encouraging them in that process. That this is what a good parent does. A good parent makes hard decisions to do the best thing for their child. Not sure there's a right answer to that question, but that's mine.
Yeah, no, that's a great, great answer. The other sort of thing that we're usually, I wonder if you could even give me just some basic stats of like how many adoptive parents are out there waiting. The other thing that is always thrown, and I do this, you know, all day long, always thrown in my face is, I'm not giving my baby up to some foster family that's going to abuse them. So I would love just to even have some basic, you know, one-liners to be able to send back to those responses.
So a couple of things to start with. Adoptive parents and foster parents are not the same thing. So making an adoption plan is not putting your child in foster care. In some situations, making an adoption plan is the only thing that some women can do to keep their children out of foster care. If they already have an active children's services case at the time that they become pregnant, it can be children's services saying, one way or another, you are not taking this baby home. So either you make an adoption plan and you get to be involved in choosing who's going to raise this baby, or we'll take care of that for you. So I do think it's important to distinguish between adoption and foster care. That's why we're actually really, really careful to call our foster homes cradle care, because legally they have to be licensed as a foster home, but we know that the idea of foster care freaks people out. And sometimes we just need a safe place for this baby to go before they can go home to their adoptive family. But in terms of families that are, we always have more adoptive families than we have children to place in them, particularly when we're talking about infant adoption. Waiting children who are in, that's a different conversation. But when you're talking about infant adoption, there are always more families than there are babies. And I can only, as far as specific numbers, I can only speak to Spirit of Faith. And the last numbers I had there, Spirit of Faith places an average of 8 to 12 babies a year. And as of the first of the year, we had 25 families with approved home studies ready to go, waiting to be chosen. So there's always more families than there are babies. Couple other questions have popped up. Why only licensed social work can do assessment? It's not specifically a licensed social worker, but the state of Ohio licenses assessors. And in order to be a licensed assessor, you have to have a degree either in social work or in counseling, and you have to take training classes that are offered by the state and maintain ongoing training to be considered a licensed assessor. And the state sets that. There are a lot of things that unlicensed staff can do in terms of working with expectant parents, but the official birth parent assessment by law can only be done by someone who is a licensed assessor by the state of Ohio. So Again, not a great answer, but sometimes the only one we get is because the state said so. And this is one of those. Yeah, and Christine brought up a good point going back to the temporary custody agreements. Up until the time that the birth parents sign the permanent custody form, so even if there is a temporary custody in place, birth parents are still the legal parents of that child, and they still have the right to visit. They have the right to come back to the hospital and visit the baby if the baby's still in the hospital. They have the right to make those decisions, and they have the right to access to that child. They don't lose those rights until they sign the permanent surrender form. Oh, this is a good question, and this one gets complicated. So for parents that are not married, do both mother and father have to agree on adoption, or can the mother make the decision on her own? The short answer is it depends, but let me give you some context around that. Ohio has what's called a putative father registry. Not sure if you guys are aware of that, but we have this wonderful thing in the state that allows men the opportunity to say, I had sex with this woman. If she tries to put a baby up for adoption, it might be mine, and I want to know. Agencies are required to check the putative father registry to see if there is anyone out there who could potentially be the father of this baby that says they want to be involved. So that's one way for a father to get involved. Ideally, yes, we want the consent of both parents. That's the right way for it to happen. That's the best case scenario, is that mom and dad are both involved from the beginning. Mom and dad are making this decision together. Mom and dad together are choosing the adoptive family, and consent happens across the board. From a practical standpoint, unless someone has signed the putative father registry, the only way we have of knowing who dad is what mom tells us. If she tells us who he is and gives us the information, we will do, as an agency, we will do everything that we can to get his consent, to get him involved, because ethically it's the right thing to do. And we want this to be above board. You know, nobody's trying to run around behind dad's back and pull one over on him. We want him involved. We want him to be on board with the process. There are sometimes very legitimate reasons why mom doesn't tell us who it is. Sometimes she genuinely doesn't know.
Right.
Sometimes there's a fear of danger. She would literally be putting herself in danger. If it was a violent relationship, if it's an unhealthy relationship, she could be putting herself at risk to tell us who he is. So we have to some extent, we have to trust what mom tells us. If at any point in the process, we become aware that dad's around, we will involve him at that point. In order to truly require consent, dad's got to be involved somehow. Just signing the putative father registry does not give him control over the placement decision. If he wants to challenge the adoptive placement in court, he can do that. And when he goes to court, he's going to be asked to demonstrate that he has been in some way supporting this pregnancy and supporting this mom. He's been giving her rides to the doctor's appointments. He's been helping her with groceries. He has been supportive and engaged and involved. And the way I usually explain it to people is, has he been acting like a dad? Is he acting like he's part of this? If he's acting like he's part of this, then absolutely 100% his consent is required. If he's wandering off doing his own thing, letting mom fend for herself, then maybe it's not. So kind of a complicated answer. I hope that helps. Current stats of birth parents who make an adoption plan and do not carry through with it. That's a really hard number to pin down. What I can tell you based on my experience is that it has happened more since the pandemic started than it did before, because agency staff and adoptive families aren't allowed in the hospital. So birth parents are there by themselves in the hospital with this baby for a couple of days, and they choose to parent because they don't have that support system around them. They don't get to see this adoptive family caring for this baby and see what that looks like. They don't get to visualize it. They're there by themselves. That is not scientific by any stretch. That is my opinion based on my observation. Usually, from what I've seen, women who choose to parent will figure that out somewhere in the middle of their pregnancy, at least prior to the pandemic. Like I said, we've had more decisions happen at the hospital since COVID started than we did before that. Before that happened, I can only think of a couple of situations that I'm aware of that decision didn't happen until the hospital. Usually it's a situation where I was talking before about the two different decisions, and getting to that second decision of, okay, who's going to parent this baby? And they go back and forth a few times. Yeah, I can handle, this is my baby, I'm going to do this. I must be crazy, I can't handle this. I'm going to make an adoption plan because I know I can't do this. Well, maybe I can. Maybe if I had some help, I could do it. What kind of help is out there? I don't know. How's my family going to feel about it? And somewhere before they actually go into labor, they've made their choice. And the adoption plan was exploring options, which is what we want them to do. Other questions? This is good stuff, guys. I'm glad we had a lot of time for it.
Are you with them then? Like, how many times on average would you say that you meet with them during the pregnancy as they are exploring those options?
It depends on what point they reach out to us. We have some women that will reach out to our agency when they're 6-8 weeks along. And at that point, we'll kind of check in with them monthly and see how they're doing. Once they get to about 5 or 6 months, that's when we really want to do the assessment process. We want to start the matching process, have them choose the parents. And at that point, we schedule regular weekly contact, Zoom meetings now. But the clinical coordinators that we have working, we assign each of the birth parent, at least at our agency. The way we do it is we assign a coordinator to each expectant mom that we're working with. And so it's the same person, and they build a relationship, and they'll do a weekly 1-hour check-in, and either just provide support or clarification for things that mom's got on her mind, or work through a process of, okay, this week we're going to talk about a delivery plan. We're going to talk about your birth plan and what you want to happen at the hospital and what things to think about. Or this week, we're going to be doing your assessment soon. So let's talk about what kinds of things you want to look for in adoptive parents. What are the important things to you? Do you want them to have other kids? Are pets important? Do you want them to have a dog? Do you want them to live in the city? Do you want them to live in a more rural? What do you want? What kind of a family do you want? And start talking through some of those things so that when they sit down to look at profiles, they have a point of reference for, oh yeah, these are the things I want to look for. Or it can be things like processing grief. and trying to prepare them for what this is going to be like on the back end, and how things are going to change for them. So we have a number of different things that the coordinators work through on a weekly basis.
Jennifer, are these adoptions open adoptions or mostly closed, or?
We request that all of our families agree to a minimal level of openness.
Okay.
And so what we ask all of our families to commit to is to send regular updates with pictures.
Okay.
And that's kind of the baseline. That's the minimum of what we ask families to do. And we give them a lot of different options for how they can set that up and how they can handle that. In some cases, it's very open, and there's regular back and forth communication between the families. Sometimes we have birth parents request a completely closed adoption. And if they're the ones requesting it, we respect that. And in that case, what we do is we'll ask the families to go ahead and do those updates anyway, but just send them to us at the agency, so that if sometime 5 years from now, mom's in a place where she wants to know how the baby's doing, we now have 5 years of updates that we can give her, and she hasn't missed out on all of that.
Perfect.
So that's what we do. You mentioned living expenses for birth mother, what's expected of the adoptive parents. State law in Ohio says that an expectant mom is eligible for up to $3,000 for living expenses. Agencies have some flexibility in how they manage that process. What Spirit of Faith does is we manage that $3,000 on behalf of the adoptive family, and we'll release half of it prior to delivery, and the second half we won't release until after placement. And birth mom has 60 days after delivery to use those funds. But what we do is, whenever possible, we make payments directly to vendors. So if birth mom says she needs help with her rent because her doctor put her on bed rest and she can't work for the last couple months of her pregnancy, we'll get a copy of her lease. We'll send the payment directly to her landlord, and we'll pay her rent. If she needs help with phone, we'll buy prepaid phone cards for her. If transportation is a challenge, we'll set up an account on Uber for her, and we'll prepay monthly into Uber so that she can get rides to her doctor's appointments and things like that.
Do you provide any type of counseling once they make the decision, or if they decide they're not going to? Is there any type of closure, any type of therapy?
Our coordinators follow up with them for a period of time, just to make sure they're okay. After a few weeks, if there's an additional need, we will try to refer them to counseling services. And Spirit of Faith is in the early stages of trying to launch a counseling division, so that we have a full service counseling
Sure.
wing to be able to provide those more in-depth, more extended, because our coordinators are really only available to address specifically adoption related kinds of stuff. But usually there's larger issues there that are more in-depth and longer term. And so we want to get them into a more full service counseling environment where all of that can be explored and dealt with. Okay, if birth moms don't want to use an agency. Okay, so there are basically two ways in Ohio that an adoption can happen. It can happen through an agency, or it can happen through a lawyer. If they want to do it privately and have it handled by a lawyer, the lawyer is still going to have to find a licensed assessor to do the birth parent assessment. The adoptive family is still going to have a home study done, either through an agency or through a licensed assessor. So all of the same legal stuff still has to happen. But if they don't want to work directly with an agency, they can work through an attorney. And if you're talking to someone who wants to do that, the one thing I will say is find an attorney who specializes in adoption. Do not use your neighbor's brother, Bob, because Bob's going to screw it up. We have had that happen where families have gone through that, you know, they found a friend of a friend to be their lawyer because they got really good rates. And the whole thing wound up taking like a year longer than it should have because the friend of a friend didn't know anything about adoption and didn't file the right stuff at the right time. And it was a mess. So no neighbor's brother, Bob. We've got just a couple minutes left. Any other questions for anyone?
This is very informative.
Well, I'm glad you enjoyed it. This is